Assalamualaikum and hi, my name is Ahmad and I'm going to introduce endometriosis and its pathway. Endometriosis is defined by the World Endometriosis Society in 2021 as a condition in which tissue similar to the lining inside the uterus called the endometrium is found outside the uterus, where it induces a chronic inflammatory reaction that may result in scar tissue. Endometriosis can negatively impact on women's reproductive health and infertility. The most common location for the ectopic endometrial implant are the ovaries, the fossa ovarica, the uterosacral ligament. The posterior cul-de-sac is between the uterus and the rectum and sigmoid. Women with endometriosis do not exhibit the mid-luteal rise, which the follicle that bursts and releases the egg during ovulation develop into the corpus luteum, which may partially explain their infertility. Now let's continue on pathway of endometriosis. Fetogenesis of endometriosis is involved in many ways. According to Bonavina and Taylor, this pathway of endometriosis that influence infertility. According to Smolas, the primary fetogenesis is retrograde menstruation, like implantation of exfoliate endometrial cell. Starting with hypothalamus secrete gonadotrophin-releasing hormone, which stimulate pituitary to secrete luteinizing hormone and follicle-stimulating hormone in the ovary and adrenal gland, then secrete testosterone, estrogen, and progesterone hormone. Then ovary also secrete aromatase enzyme. Aromatase enzyme that convert to estrogen and estradiol present in abnormal level. It is an estrogen-dependent disease that increases estrogen production in the endometrium. Progesterone resistance and dysregulation of progesterone receptor also appear to play a role in implantation failure. Progesterone receptor has been shown to be dysregulated in both ectopic and ectopic endometrium. This causing an unopposed estrogen state. Without progesterone balancing influence, estrogen can work overtime in the body and cause cell overgrowth in uterine walls lining, cause irregular or heavy period. Abnormal progesterone resistant and imperceptibly persistent expression of matrix metalloproteinase that remain elevated during inappropriate period. The disinhibition of this protein could lead to constant matrix breakdown, not conducive to implantation, and also cause irregular and heavy menstrual bleeding.
Do you know what are the causes of endometriosis? During a regular menstrual cycle, the body sheds the lining of the uterus. This allows the menstrual blood to flow from the uterus through the small opening in the cervix and out through the vagina. The exact cause of endometriosis is uncertain. There are several theories regarding the cause, although no one theory has been scientifically proven. According to Simpson's theory, endometriosis occurs due to a process called retrograde menstruations, which 90% of women experience, according to the research. This happens when menstrual blood flows back through the fallopian tube into the pelvic cavity instead of leaving the body through the vagina. Other than that, Mayer's theory states metaplasia is the transformation of one cell type into another. Thus, this theory explains that peritoneal cell could change into endometrial cell. The triggering factor for this change could be the response to inflammatory processes or be due to hormonal or environmental stimuli. It's also possible for the menstrual blood leaks into the pelvic cavity through a surgical scar, such as after a cesarean delivery, also commonly called a C-section. Another theory is Halban's theory. This theory finds out that endometrial tissues could circulate through blood vessel or the lymphatic system to other parts of the body. However, this explanation alone fails to clarify how the adhesion necessary to form the endometriotic implant occurs at these distant locations. Some believe endometriosis might start in the fetal period with misplaced cell tissues that begins to respond to the hormones of puberty. This is often called Mullerian theory. The development of endometriosis might also be linked to genetics or even environmental toxins.
Period pain should not be debilitating. If someone tells you that your back cramps are normal, don't believe in them. You could have endometriosis. Here are 5 warning signs or red flags that tells you something definitely not normal is going on. Number 1. Menstrual cramp. We are talking pain that makes you miss school or work, or pain that doesn't go away with anti-inflammatory medication like ibuprofen. According to Taylor et al. 2019, concentration of prostaglandin are higher in the menstrual blood of women with endometriosis. Increased prostaglandin production by cyclooxygenase 2 in the uterus during menstrual, resulting in pain. Number 2. Chronic pelvic pain. If you have severe pain in your pelvis all the time, not just when you have your period, according to Agarwal et al. 2019, pelvic pain and cramping may begin before and extend several days into a menstrual period. Pelvic pain are common among women with endometriosis. However, pelvic pain that is described as chronic or worsening over time increase the likelihood with endometriosis. Number 3. Painful sex. According to WHO, pain during sexual intercourse could be a sign of endometriosis. Penetration can pull and stretch endometrial tissue that has grown behind the vagina or lower uterus. Number 4. Pain with bowel movement or urination. According to the WHO, these symptoms are more likely to experience during a menstrual period. The last symptom is infertility. According to Thomas Etty and Lee Hockey 2018, there is possible biological explanation for a causal link between endometriosis and infertility. For the first one is pelvic cavity, chronic inflammatory changes in the peritoneal fluid affecting egg quality, follicular genesis, and luteal function. The second one is ovarian dysfunction due to chronic inflammatory changes in the pelvis, and the third one is uterus, altered endometrial receptivity mainly due to chronic inflammatory changes.
How is endometriosis diagnosed? So, this is how the normal uterus and the condition of uterus that affected by endometriosis. In many cases, an endometriosis diagnosis will start with your symptoms. Painful and heavy periods might cause you to reach out to the doctor. Once at an appointment, the doctor may start by asking you for your personal medical history about any previous pregnancies, and if any other people in your family have endometriosis. Here, I stated 5 ways or procedures that the doctors usually use to diagnose the endometriosis depending on the symptoms. Firstly, pelvic exam. Pelvic exam is a physical exam of the vulva, vagina, cervix, uterus, fallopian tubes, ovaries, and rectum. A doctor or nurse inserts 1 or 2 lubricate glove fingers of one hand into the vagina and presses on the lower abdomen with the other hand. It's done to feel the size, shape, and position of the uterus and ovaries. If the doctor needs more information, they likely perform pelvic imaging starting with an ultrasound. Endometriosis ultrasound is an imaging procedure that helps the doctor determine if you have endometriosis. Ultrasounds can show large lumps of tissues that are likely signs of endometriosis. It's also very good at identifying endometriosis of the ovaries. Then, MRI. An MRI is a type of imaging test that creates detailed pictures of internal structures within the body. When you go inside an MRI machine, the scanner uses a large magnet and radio wave to capture detailed pictures of your organs, bones, muscles, and other tissues. A pelvic MRI can capture image of endometrial growth that lies within the pelvic cavity. An MRI can see deeper into the body than an ultrasound. This means it helps the doctor to identify deeply infiltrating endometriosis. The fourth one is laparoscopy. Laparoscopy may be offered for both definitive diagnosis and treatment. It can be a useful way to confirm endometriosis because your surgeon doing the procedure can use a small camera called a laparoscope to look inside your body. Endometriosis laparoscopic surgery treats mild to severe cases by skilled surgeons trained in this method. During the procedure, they make a small incision in your abdomen so they can insert a tiny tube with a camera through it. Last but not least is biopsy. In the procedure of doing this diagnosis, the doctor will insert a device called a speculum into the vagina. This holds it open during the procedure. After the cervix is cleaned, the doctor will insert a very thin, flexible tool to gently suction out a tissue sample from the lining of the uterus that called endometrium. This will then be sent to a lab so it can be looked at under a microscope and tested for abnormal cells like cancer.
Making a baby isn't always easy. Fortunately, there are many ways to parenthood. Assisted reproductive technologies (ART) are used to treat infertility, and there are 2 types of ART due to endometriosis include intrauterine insemination (IUI) and in vitro fertilization (IVF). Let's take a look at the treatments currently available. First is intrauterine insemination or IUI. So how does it work? Let's take a closer. It is a sperm injection. During an IUI, the sperm are placed directly by injecting the sperm into the uterus. This bypasses the vagina and the cervix. When is IUI suggested? According to Kohlen et al. 2018, for infertility related to endometriosis, IUI with or without ovarian stimulation (OS) has become a first-line treatment option for many infertile couples worldwide. It is an option because it is a lower-cost alternative to in vitro fertilization (IVF) and minimally invasive approach. Who is an ideal candidate for IUI? According to Chai et al. 2022, American Society for Reproductive Medicine state that IUI treatment is only recommended in subfertile women with stage 1 or 2 endometriosis. How IUI fix infertility with endometriosis? During an IUI treatment, the sperm are placed directly into the uterus and bypasses the vagina and the cervix. As a result, it will be increasing the number of healthy sperm that can reach the fallopian tubes when the woman is most fertile. According to Alia et al. 2022, compared to intercourse alone, the chance for pregnancy with IUI is better. If IUI with fertility drugs is unsuccessful, IVF treatment is usually the next step. According to Tambo and Federsac 2017, patients with minimal or mild endometriosis-associated infertility achieve lower success rates with stimulation. Overall, the procedure itself is quite minimal. Second is in vitro fertilization or IVF brings the miracle of conception into a laboratory. So how does it work? Let's take a closer. Step 1 is oocyte or egg retrieval. Once the eggs are mature, it is time for egg retrieval. During this step, a suction device connected to a long, thin needle is inserted through the vagina. This will puncture ovarian follicle and pull the mature eggs out. Removed eggs are placed in a petri dish containing a special solution and then placed in an incubator. Step 2 is fertilization. Fertilization may be performed by insemination where several sperms are mixed with the healthiest eggs. Step 3 is embryo development. Fertilized eggs called embryo will be monitored for several days with cells activity dividing. The last step is embryo transfer. An embryo or embryos are then injected into the uterus. When is IVF suggested? If a woman has been having trouble to achieve live birth, then IVF becomes an option. After failure of other lines of treatment, who is an ideal candidate for IVF? According to Messer and Taylor 2012, for women with suspected stage 3 and 4 endometriosis, IVF is recommended. The National Institute for Health and Care Excellence NICE fertility guidelines recommend that IVF should be offered to women under the age of 43 who have been trying to get pregnant through regular unprotected sex for 2 years, or who have had 12 cycles of artificial insemination with at least 6 of the cycles using an IUI method.
How IVF fixes infertility with endometriosis?
During IVF, collected eggs are fertilized in a laboratory setting. This process minimizes the risk of sperm or egg damage due to endometriosis. Once eggs have been successfully fertilized, selected embryos are transferred directly to the uterus. Embryo transfer bypasses the fallopian tubes where blockage from endometriosis are common. Thus, IVF is currently the most effective treatment option for endometriosis-associated infertility.
What else can be done to raise the awareness for this disease? First, be active in Endometriosis Awareness Month. The entire month of March is dedicated to raising endometriosis awareness and is marked by yellow ribbons worldwide. It begins in 1993 and is now celebrated globally through educational forum and outreach, various types of fundraising, and march to raise awareness and the funds needed to provide care and continue research on these conditions. Next, talk about endometriosis facts with family and friends. Talking about this common and painful condition in such a circle is one of the simplest ways to raise awareness about it. Other than that, by sharing articles on social media, everyone uses social media in some capacity and many admit to getting most of their daily news from it. Because of its popularity, social media is an excellent way to share information. Then, get political. Becoming an endometriosis advocate allows someone to use their voice to promote policies that benefits other women. Lastly, share their experience. If someone has endometriosis, they can educate others about the condition and their medical journey by starting their own blog or sharing the story online.
As a conclusion, endometriosis happens when tissue similar to the lining of your uterus grow in places it doesn't belong, like on your ovaries, fallopian tube, or outside the uterus. There are many pathways that lead to endometriosis that influence infertility. The primary pathway in most cases is retrograde menstruation that have effect on endometrium. Abnormal of aromatase enzyme lead to increased estrogen in ovary, thus cause an unopposed estrogen state make it not suitable for implantation. And for progesterone resistant and dysregulation of progesterone receptor is a downregulation, make implantation failure for endometriosis patients. Next, there are 5 causes of endometriosis. The first one is retrograde menstruation. The second one is peritoneal cell could change to endometrial cells. The third one is endometrial tissue could circulate through blood vessel or the lymphatic system to other parts of the body. The fourth one is fertile period with misplaced cell tissues, and the fifth one is genetic or even environmental toxin. Next, 35 symptoms of endometriosis. The first one is menstrual cramp. The second one is chronic pelvic pain. The third one is painful sex. The fourth one is pain with bowel movement or urination. And the last one is infertility. For diagnosis of endometrium, the first one is pelvic exam. The second one is ultrasound exam. The third one is MRI. And the fourth one is laparoscopy. And the last one is biopsy. And lastly, for treatment, IUI treatment is only recommended in subfertile women with stage 1 or 2 endometriosis and achieve lower success rate with stimulation. And the second treatment is IVF. IVF is currently the most effective treatment option of endometriosis-associated infertility. For women with suspected stage 3 and 4 endometriosis, IVF is recommended.